in Africa, especially in Taita Taveta, we have most commonly children who are sick, living with terminal illnesses, and their conditions are wanting because of the stigma that is in our community. And you find that these children don't even go to school or even do social interactions because they have been locked up by their parents or their guardians. Sickle cell and hemophilia are inherited blood disorders. Mostly in hemophilia, the clotting factors are not okay, so they bleed a lot, and mostly on the larger joints, the small joints, you find where the joints are more active, they tend to like have a lump. So it is because their blood they don't have some of the clotting factors. What we do is we supplement them, or they get clotting factors from the hospital, which now helps them live a normal life. For sickle cell, this is also an inherited disorder, and this is where now the the red blood cell, normally it is circle, but now in this condition they become sickled. The name sickle cell comes from the shape of the red blood cell. Is this sickle that people used to cut grasses, or it is now when it is like that, you see it has a defect. You see, sickle cell could be everywhere, but there are areas that are rampant, like Taita Taveta. We have Kisumu, yeah. So we have the coastal region. So you get that in our support group, we have a sickle cell support group. We have 20 children who attend. This disease come in because either one of the parents has a trait or is a carrier of this disease. It is very important, especially if someone is planning to marry or get married, just like they do HIV and these other tests. Sickle cell screening is very important because this dictates your generation. This dictates even your willingness to marry this other partner with their condition, because this is a lifetime condition. And it helps someone to make an informed decision. And just to say that just because someone is a sickler does not mean that they cannot get married. They can marry and they can live a quality life, but it is good to know and make an informed decision. Yeah, so these children also present with signs like anemia. They present with anemia, so they will complain of dizziness, weakness of the body. In Taveta, they call the sickle cell disease manjano, because the children or people living with sickle cell disease present with jaundice, which is now the yellowness of the eyes. We also encourage them to engage in board games, especially the Scrabble, drafts, Ludo, because these games are friendly to them, so that they do not engage in these other games that could maybe they can be hit with a ball, and this could cause them to bleed, you know. So we avoid such things. We also tell them to avoid injuring themselves. We encourage the parents to create a safe environment for them, and also now we're trying to reach out to schools to also educate them on how to take care of these children when they are there. Currently, with the support of the African Sickle Cell Organization and our team lead, Dr. Rebecca Makichako, who heads the hematology department at Moi County Referral Hospital, we have plans to do outreaches, but we plan to start outreaches to institutions and also schools. The teachers need to understand that these children need special care, specialized care, so that they can live a quality life. You see, the teacher is the second parent, because from home to school, they need to understand how this disease comes about, They need to understand how whatever drugs these children are on, their side effects, their diets, yeah, knowledge about the disease, and yeah, just majorly awareness to them. They know what the disease is and what it entails. Even our patients, some doctors, they have come across some doctors giving them 3 years to live, some giving them up to 17 years to live. But in our support group, we have a 53-year-old who is an engineer, a very learned fellow, and you know, and it was so encouraging when he came because most of the children that day felt like a new hope, a new ray of hope has come. It encourages because now it demystifies this thing of telling people you're dying tomorrow, you're dying, you have this time. So a person with sickle cell disease can live as long as they are following whatever the drugs, the doctor's appointments and reviews, and they are on proper care. So sickle cell disease is not a death sentence. Living with sickle cell disease does not mean that you're dying after 3 years or 5 years or 10 years. No, someone can live as long as God wants. The county has taken measures in partnering with the African Sickle Cell Organization, with the lead being Lea Kilenga, who is also a patient advocate and the founder of this organization. They have been supporting us and they still do support us in our sickle cell clinic, and even they have helped in initiating there's a newborn screening, early newborn screening in our hospital. So this is a plus because now when a child is born, we are able now to know if this child is a carrier or is a patient uh, of this disease. So African Sickle Cell Organization, we say also a big thank you in supporting palliative care. We are guided by an umbrella body called the Kenya Hospices and Palliative Care Association, which now regulates matters to do with palliative care all over the country. They have been of support, especially in guidance and even in patient care. We also have Hospice Care Kenya, UK. This has been actually our main support. If you want to find me, you can always visit the oncology unit at my County Referral Hospital, consultation room number 2. Social media handles at Blossom CBO, that is YouTube, Twitter or X, uh, Facebook, and Instagram, also TikTok.